Hi, it's Dr. Cruz with the Foot and Ankle Clinic, and today I'm talking about, or briefly summarizing, what a bunion deformity is and ways in which you can treat it. Bunion deformity, if you're looking at your own foot, look down, it typically occurs at the big toe joint, and what will happen is you'll have an increase of your inner metatarsal angle, which just basically means that the long bone going up to your first toe is shifting out towards the inside of your body, and therefore you'll see a big bump right at the knuckle of your big toe, and usually there'll be a deviation of the big toe itself will start to push into the smaller toes. A lot of people will have bunion deformities, and it typically is inherited in the sense that you've inherited your foot type from your parents, and so you were sort of predestined to develop a bunion. And then of course it's aggravated by different types of shoe gear throughout your life, or different types of activities, people that are on their feet more, people that are runners, or teachers, waitresses, people like that will tend to or could potentially develop bunion pain earlier than other people. So after you've looked at the foot and you're determining, or you're feeling pain in your big toe joint, and you come into the doctor, then basically you're assessed, and there's two different ways that you can treat it. You either treat it conservatively, or ultimately you'll have to treat it surgically. There's no way to reverse a bunion deformity. There's no contraption that's going to be able to pull that toe out straight. The only way that you're ever going to get rid of it once you have a bunion is to have surgery or a bunionectomy. This is an example of a bunionectomy. Just sort of briefly, this is a pre-operative x-ray. So a patient came into the office, and this is what I was talking about before, where you have the increase of the intermetatarsal angle. Anyway, this first metatarsal is tilted more and more out this way. You'll get a bump or a prominence of bone on the inside of your foot, and this first toe will start to tilt into the other toes. So this particular patient was having pain at the joint. She tried to treat it conservatively, which is trying to accommodate it, wearing wider shoes, but it starts to become more and more limiting for your life. Then you need to start thinking about surgery. So this particular patient had surgery, and this is just a post-op x-ray of the surgery. Pretty simple. A head osteotomy was done with a screw fixation. I did this surgery, and you can see where we have taken off the bump of bone. I've slidden the head of the first metatarsal back into position so that this angle here is more parallel with itself now, and the first toe is pulled out so that it's no longer leaning into the lesser toes but is straight again. And the healing time for a bunionectomy is about 4 to 6 weeks. I usually tell patients. Typically you're able to walk on it even after surgery. And the reality is that if the foot is painful, and no matter what shoe you wear, it's painful in the big toe joint, then probably a surgical bunionectomy is what you're looking at. It's done outpatient and can be relatively simple or non-invasive as far as your life, and then the pain is gone and you feel better afterwards. So for this or any other further information, you can contact the Foot and Ankle Clinics of America, and our website is footexperts.com.